Happy Chinese New Year. Adik ni tanya ask about HOCM. HOCM is basically hypertrophic obstructive cardiomyopathy. So if we talk about cardiomyopathy in children, there are probably three main type of cardiomyopathy. You can classify it into dilated cardiomyopathy and then the hypertrophic cardiomyopathy. These two are the most common type of cardiomyopathy in children. Lastly is restrictive cardiomyopathy, but this one is very, very rare. So far I've only seen one throughout my 14 years of working. So we focus on dilated cardiomyopathies. Basically the heart chambers become dilated. The reasons can be infection. Most of the time is virus. Common virus like your CMV, cytomegalovirus, your EBV, Epstein-Barr virus, your parvo-B19 viruses. Can be also your COVID as well. All these things can cause myocarditis lah. When patient have myocarditis, the heart tissue become dilated, so it will cause reduce in ejection fraction. There will be severe material regurgitation, then reduce ejection fraction. So patient can present with cardiogenic shock. They can have tachypnea, but somehow presumably the fever and the cough can present like pneumonia lah. But when do the chest X-ray and all that, the lung field is quite clear, but the heart is very dilated lah, cardiomyopathy. Alright. Other causes of dilated cardiomyopathy in children, other than infection, other than infective cause, it also include your genetic causes or metabolic causes, or inborn error of metabolism, like your Pompe disease, like your Danon disease and all that. Okay, but certain problems like muscular dystrophy like Duchenne also later on can have dilated cardiomyopathy over time because of the issue with the muscles. So this is one of the common causes of dilated cardiomyopathy in children. So if you want more causes, you can read up about dilated cardiomyopathy. Usually if patient come with dilated cardiomyopathy, myocarditis on it, we always work up for infection. Secondly, the metabolic or genetic causes of the dilated cardiomyopathy. Alright. Okay, the next type of cardiomyopathy in children is the hypertrophic obstructive cardiomyopathy or HOCM. The main cause of HOCM in children, in pediatrics, in neonate especially, is infant of diabetic mother. So what are the difference between the dilated cardiomyopathy and hypertrophic cardiomyopathy is the dilated is involve all the lateral wall ventricle tissue and the atrial wall tissue, so it become dilated, while hypertrophic is just most of the time in the septum of the ventricles. Okay, when the septum become thickened and become over time become very big, so it can cause obstruction at the ventricular outflow tract, especially the left side. So it causing some pressure gradient difference, so cause something like aortic stenosis, but at the level of LVOT lah, which is your left ventricular outflow tract, while the aortic stenosis happen at the level of the valve. Okay, so certain genetic condition also can cause HOCM, like Noonan syndrome. Those are basically two examples that I can give you. If you want more causes, you can read up about HOCM lah. So in HOCM in infant diabetic mother, usually the prognosis are very good. Over time, it can resolve over time lah. How diabetic mother will lead to babies having HOCM is because something to do with the high level of insulin, high level of growth IGF, which is something growth hormone related. So it causes hypertrophy of the septal wall. Okay, so once the baby is delivered, the production of the IGF become less, so the stimulant is not there, so the heart can remodel over time. So that's why we said the HOCM in IDM babies usually can resolve after a while. It's temporary condition. Okay, very good prognosis. Alright.